The topic of this next video lecture is really important for those going into healthcare, and this is going to be about healthcare associated infections, or HAIs. And an older term for this is nosocomial infection. So, and you will hear both of those used. HAI is the more modern term, but there are still going to be people around who use the older term nosocomial infection. So you want to just understand that if you hear somebody using that term, it's referring to HAIs. So what are these HAIs, nosocomial infections? These are infections that are acquired by a patient or a healthcare worker in a healthcare facility. So a patient or a worker comes into the facility, doesn't have the infection, they pick it up there. So this is very common. This is going to be one of those things that they really preach to you about as you're going through nursing, dental hygiene, or any other healthcare related area. So some kind of scary statistics here. About 10% of U.S. patients each year will acquire an HAI. That's pretty scary. So 1 in 10. And 90,000, sometimes you'll see this number closer to 100,000 deaths each year in the United States from healthcare acquired infections. So this is, that's pretty scary. 90,000 patients per year are dying of something that in all likelihood they didn't have to contract. And so it's really important that we do everything that we can to try to prevent the spread of these types of infections in the medical setting. The most common parts of the body, a urinary tract, very common because a lot of patients have Foley catheters inserted into the urethra and to allow the bladder to drain. And that's a source for infection. Respiratory, especially if you're on an if you're on a respirator, you're intubated. Cardiovascular, patients have IVs. They have those central lines with ports on them that are stuck into their subclavian veins, and you've got a needle that's piercing the skin and going directly into the bloodstream, and so that's got to be, you've got to use strict antisepsis techniques to try to limit the possibility of those types of things becoming infections. The skin, any type of surgical wound, or any other reason why you might enter the hospital with a breach in the skin, that's just an open invitation to infection. All right, HAIs can be classified as exogenous or endogenous. So exogenous means that they have come from outside the body. So you have acquired the pathogens from the healthcare environment. They may have been on equipment. A healthcare worker may have been a passive carrier, like we talked about in an earlier video clip. An endogenous HAI is going to be caused by the patient's own normal microbiota. So let's say some bacteria from fecal matter got transferred into the urethra when a Foley catheter was inserted, and then that causes a urinary tract infection. That's an example of an opportunistic infection. Fecal bacteria, generally harmless when they're in the intestinal tract, but if they get into the urinary tract, they get into the blood, they get into the respiratory tract, they get into a wound on the skin, they can become pathogenic and cause an infection because they're in a part of the body where they are not supposed to be. Another term you should be familiar with is iatrogenic infection. That is not latrogenic, it is iatrogenic infection. So that's any type of infection that is caused by a medical procedure, like a catheterization, some kind of diagnostic procedure, or surgery. Now, an iatrogenic infection could be either exogenous or endogenous. It depends on the source of the microorganism. So if you have surgery and a patient's skin bacteria are transferred into the bloodstream or some other deeper part of the body, that would be an example of an iatrogenic infection that's endogenous. If during surgery there are bacteria from the environment on a surgical instrument and they get transferred into the body and cause an infection, that would be an exogenous form of an iatrogenic infection. And sometimes you may not know. You don't always know whether the HAI was exogenous or endogenous, because very often the same organisms will be involved in both types. All right, so we've already talked about how normal microbiota can become opportunistic pathogens. Anything that suppresses your immune system, and sick people generally have weakened immunity, but even old age, just poor nutrition, if you're undergoing stress, you're taking immunosuppressive drugs for some reason, like maybe you've had an organ transplant, when you're being treated for cancer, the chemotherapeutic drugs used for cancer treatment often weaken the immune system as well. So those are all things that can allow normal microbiota to overgrow and reach the point, reach a population where they start harming the body. And of course, if they get into, like we've talked about, if normal microbes get into a part of the body where that's not their natural habitat, they can cause infections there as well. Good old E. coli, it's a mutualist in the colon. It does nice things for you, so we both benefit. But if it gets into the urethra and causes a urinary tract infection, it's going to be an opportunistic pathogen. Same thing, E. coli can actually cause pneumonia if it gets down into the lungs. Now, a normal, healthy person walking around is not very likely to get E. coli pneumonia, but in a medical setting with patients who are intubated on a respirator, much, much more likely to happen. Or E. coli can get into the blood and cause septicemia. E. coli is a pretty common cause of a septicemia, a blood infection, which can often be fatal. We've talked about microbial antagonism before as well. It's important to try to maintain a healthy, normal microbiota because having them there, they antagonize, outcompete organisms that can become pathogenic. And of course, we've talked many times, you take an antibacterial drug, wipes out a lot of your normal, a strong one, a broad spectrum antibacterial drug, wipes out a lot of your normal bacterial microbiota, and that allows other things to overpopulate, like good old Candida albicans, yeast. You can develop a yeast infection from that. Sites of HAI, so I just covered some of this, but this is a pie chart from your textbook which gives you a little bit better visual on this. So 40% of HAIs are urinary tract infections, 19% are surgical site infections, 15% respiratory, 12% in the other category, 8 on the skin, and 6 septicemia, blood infections. But without actually looking at the statistics, no doubt that a lot of the deaths occur from septicemia. Really easy. So here's a diagram over here showing a Foley catheter inserted up the urethra and on into the bladder to drain urine out of the bladder. So it's real easy to drag microorganisms all the way up into the bladder when a Foley catheter is inserted. Plus biofilms can form inside those catheters, and then microorganisms can break off the biofilm and wind up in the urinary tract. Patients who are on a central line where there's a needle in place and sticking into a subclavian vein in the upper chest, and you've got these little ports on here that are used to withdraw blood or inject drugs and so forth into the body. You know, every time you open up one of these ports and screw a syringe on there, there's a risk that you're going to shoot some microorganisms directly into the bloodstream. So you have to be really, really careful. And even some friendly skin microorganisms like good old Staphylococcus epidermidis, which is covering all of our skin. It's harmless on the skin. It's helpful to us for it to be there. But if it gets shot through a central line directly into the bloodstream, it can cause septicemia that can be fatal. So you have to be really, really, really careful. You have to use very good aseptic technique when you're working with patients who have things like central line IVs put into place. Surgical site infections, or SSIs, that's a abbreviation for surgical site infection. Those can be classified according to the depth. You know, where is the infection occurring? It may just be superficial around the incision, so in the skin or down in that hypodermis, that subcutaneous layer. Deep incisional if the infection is down in the muscle or the fascia. And then in some instances you could have an organ space SSI, so it might be in a body cavity, you know, so a very deep infection. So those SSIs, those surgical site infections, can be classified in different ways. These are some statistics I pulled from I'm pretty sure I pulled this off of the Centers for Disease Control. Yeah, I pulled this off of the Centers for Disease Control website. If you Google CDC HAI, it'll pull up a very extensive website for you with lots of really good information about healthcare acquired infections and and what's the latest info on some of the more common organisms that are associated with those. But some pretty staggering numbers over here. So these are estimates of healthcare associated infections occurring in acute care hospitals in the U.S. in 2011. And so they're showing you some of the sites where these are occurring. And some of these numbers are going to be a little bit different from the pie chart in your textbook, because there's likely some fluctuations from year to year. But look at the total there, 721,800. That's a lot of people getting infections that they probably did not need to get. They didn't have that when they arrived in the hospital. And here they're showing you the types associated with things like catheters inserted into the urinary tract, central lines, 30,000 just from central line placement leading to bloodstream infections, 53,700 SSI, surgical site infections. And here's that C. diff, good old Clostridium difficile, 107,000 C. diff infections. That's a huge problem in the medical setting. Remember, that C. diff makes endospores. It's real easy for you as a healthcare worker to wind up being a passive carrier of those endospores from one patient to another. So you have to pay close attention. If you have a patient who is infected with C. diff, the hospital is going to have special procedures that are needed for decontaminating the room of that patient, and you've got to follow all of the contact precautions and so forth that are in place, special rules about gowning and gloves and masks, all that kind of stuff. You really have to follow those rules really closely, because if you don't, you're increasing the likelihood that you are going to transmit one of these HAI organisms from one patient to another. I pulled this off of here's a link to the CDC website on HAIs that I mentioned earlier, and this is a great site to check out. They've got links to a number of the different organisms that are responsible for HAIs in the United States. So this is really a good thing to look over. Most of these are bacterial. Norovirus causes a horrible intestinal viral infection. You may have heard of that before. That's also the virus when you hear about outbreaks of gastroenteritis on cruise ships. Norovirus is usually responsible for that. A lot of times, when you have one of those gastrointestinal bugs going around, everybody's getting it and puking for a couple of days or so. Norovirus is often involved in that, and it spreads really easily in hospital settings. Apparently, the infectious dose is pretty low for that virus, so it's easy to transmit in hospital settings. Tuberculosis, that's pretty scary. We're beginning to see more and more drug-resistant strains of tuberculosis, so that's scary. It's scary to think that that's an organism you've got to be concerned about in the healthcare settings. This one is nasty too. This vancomycin-resistant Staphylococcus aureus, methicillin-resistant Staphylococcus aureus. This is MRSA, MRSA. That's a big-time problem. And now vancomycin-resistant Staphylococcus aureus is another strain that has emerged resistant to these pretty commonly used antibiotics. This is a nasty one too, VRE. You guys will hear about that. Vancomycin-resistant enterococci. So enterococci, that's the Enterococcus genus. That's a common organism in the intestinal tract. It's part of your normal microbiota, but if it gets into other parts of the body where it's not supposed to be, it can cause infections. And there's a strain now that's resistant to vancomycin, which is kind of like an antibiotic of last resort. It's very powerful stuff. And so that's not good news that we have a vancomycin-resistant strain of that organism around. It makes it very difficult to treat. How do we control healthcare-acquired infections? Well, first of all, three things generally have to come together for a nosocomial infection or an HAI to occur. You got to have the microbes in the hospital environment, which, yes, they are. Compromised host, weakened immunity, yes, they're always going to be there. And then third, you got to have some sort of chain of transmission to get those microbes from one patient to another. Now, there's no way to avoid this. You're going to have microbes in the hospital environment. You're going to have compromised hosts. This is where you need to try to break that chain of transmission and be very conscious of not being a transmitter of microorganisms from one patient to another. So following all the rules about disinfection and asepsis, we learned about that back in Chapter 9. You want to try to maintain a pathogen-free environment if possible. Good housekeeping, hand washing, bathing, handling foods in a sanitary manner, following all the asepsis rules for surgical procedures, using gloves and gowns and caps and masks when you're required to do so, making sure the surgical fields, the areas where surgery are being performed on the body are cleansed properly. Hand washing is the #1 key to reducing HAI incidence. There's no doubt that's going to be preached to you. You do want to check out your textbook in Chapter 11. Has a section on kind of a summary of the CDC universal precautions. So these are rules that all healthcare workers are supposed to follow to help limit the spread of HAIs. And you guys can kind of read through the summary here and also in your textbook. There's a link here in the full PowerPoint which will bring you to the full set of universal precautions. But you want to read over those and be familiar with these. A lot of them are common sense, like handling needles and other sharp instruments. About 10% of healthcare workers each year are pierced by a needle. That's pretty scary. So, and there are rules in place to help you avoid doing that. So you never want to recap a needle, for example, or pull a used needle off a syringe. I think you would probably get yelled and screamed at big time if you tried to do that. But in the past, it was not an unusual practice. Pregnant workers need to be extra cautious because you have weakened immunity, so you're more likely to pick up a healthcare acquired infection when you're pregnant. And keeping up with your vaccinations, that's absolutely essential because you don't want to wind up picking up a microorganism that you could have been vaccinated against and potentially, you getting sick and then you also transmitting that to people in the hospital who have weakened immunity. So that's a extremely important topic. HAIs, can't emphasize that enough. All right, the next little video clip here, we're going to talk briefly about etiology. That's what's causing the disease. And then that'll finally lead us to the last video clip for Chapter 11. This is a long chapter where we'll talk more about epidemiology, and we'll see how that's different from this other E word, etiology.